So cellular immunotherapy for T-ALL has been lagging behind the same approaches for B-cell malignancies, largely because the antigens that we can target in T-cell ALL are also expressed on normal T-cells, including CAR T-cells, which leads to, first, the problem of CAR T-cell fratricide or self-targeting, which needs to be obviously mitigated. Second, there's a risk of ablation of normal peripheral T-cells and subsequent immunosuppression in these patients. And third, oftentimes the initial starting cell product contains the malignant blasts, and so potential transduction of these malignant blasts can lead to the emergence of antigen escape mutants. And so really these three problems have to be solved for the therapies to be safe and effective. One approach to get around that is to target antigens with restricted expression on normal T cells, such as CD1A or components of T cell receptor complex. And those are also expressed in some patients with T-ALL. But if we want to target as many patients as possible, the best approach is to target pan-T cell antigens, such as CD5 and CD7. And but obviously, this approach is associated with the risk of fratricide and T cell ablation. So we've developed a CD5-specific CAR in the past, and we found that the expression of this CAR on T cells actually surprisingly leads to resistance to fratricide, as T cells downregulate and degrade CD5 protein very efficiently. They become essentially invisible for each other and evade fratricide very efficiently. And so we have conducted a phase 1 clinical trial with autologous CD5 CAR T cells very recently. It shows very promising results for patients with refractory and relapsed T-ALL. Unlike CD5 CAR, expression of the CD7 CAR actually leads to significant fratricide in T cells. And that is because the downregulation of CD7 antigen is not nearly as complete as CD5. And so additional measures have to be implemented to mitigate T cell fratricide, such as editing out the CD7 gene with CRISPR-Cas9 or trapping its expression inside the cells. And all these preclinical studies have been published in the past few years. However, clinical implementation of these strategies have been sort of lagging in the Western world. However, there has been a lot of clinical studies in China using autologous and allogeneic CD7 CAR T cells, and the early clinical data from these trials have been very encouraging. So I summarized some of these clinical trials in my talk. So we right now live in a very exciting time where finally I feel like we can start offering patients with refractory and relapsed T-ALL some immuno-engineered cell therapy products that can really move the needle in this field and offer much needed clinical solutions. Thank you.